This video demonstrates how to obtain pediatric vital signs. Equipment required includes the following: a digital tympanic or temporal thermometer, thermometer probe covers as required, a watch or clock with a second hand, a pediatric stethoscope, a sphygmomanometer with a pediatric-sized cuff, a pulse oximeter, biohazard bags. While these come in various colors, they can be identified by the universal biohazard symbol. Please check your institution and state regulations to confirm which bag is used. Alcohol swabs, gauze swabs, and the necessary documentation. To begin, wash and dry your hands. Assemble the equipment needed for the procedure. Clean the sensor and probe surface of the temporal thermometer using an alcohol swab. Apply a probe cover to the digital and tympanic thermometers. Clean the stethoscope diaphragm. Check that a watch or clock with a second hand is in sight. Ensure that the sphygmomanometer and cuff are in working order and of an appropriate size for the child. Check that the pulse oximeter is working and clean the finger probe with an alcohol swab. Confirm the child's details. Explain the procedures to the caregiver and the child in an appropriate manner. Address any concerns or questions. Obtain a brief history of any symptoms and obtain consent from the caregiver. Ask the caregiver to undress the child, leaving the undergarments on. Discuss how the caregiver can assist in the procedure. Position a young child on the caregiver's lap. An older child may sit on their own. Blot any visible perspiration and remove any obstructions, such as hair or headwear. Position the probe of the temporal thermometer in the center of the forehead and ensure that the probe is flush with the skin. Press and hold the scan button. Slide the probe across the patient's forehead, keeping it flat on the skin. When a measurement is reached, a light will flash and the thermometer will beep. Release the scan button and remove the probe from the skin. If there is perspiration on the forehead, lift the thermometer off the forehead with the button still depressed and place the sensor on the child's neck, just behind the earlobe. Read and record the reading from the digital display.